your PSA is raised, or if your prostate feels abnormal on a digital rectal examination, then you may need to be considered for a prostate biopsy. If, however, you have medical conditions that mean that your life expectancy is not going to be more than, for example, 5 years, then you may not need a prostate biopsy. It will be open to a urologist to discuss that with you. Basically, how a prostate biopsy is done is an ultrasound telescope or probe is placed into the back passage through which we can see the prostate. And using that, we can guide needles into the prostate and take multiple samples of prostate tissue or prostate material and get that assessed. When the ultrasound probe is in the rectum, we can get images of the prostate, and they can form grids of the prostate through which we can take a number of samples where multiple needles are passed into the prostate to get tissue from the prostate. That material is then sent to a pathologist who looks at the material under a microscope and tells us whether the cells in the material are normal prostate cells or cancer prostate cells. In this picture, you'll see a prostate that has been removed in its entirety and cut down the middle. The urinary passage is represented by the slice here, and this is the inner part of the prostate, and then there is an outer part which we call a peripheral zone. And it is in the peripheral zone that we tend to get prostate cancers, as demonstrated by this slide. This is why we tend to biopsy the prostate from the back to get samples. Rarely, though, prostate cancers can form in the front of the prostate, and they can be difficult to diagnose and may require different methods to locate those cancers.